Dr. Muntas Musame is the Vice President of the Palestinian Australian New Zealand Medical Association, and he joins me now. Good to have you with us today. We've just heard there from the Israeli Prime Minister Benjamin Netanyahu claiming that there is no starvation in Gaza. Can I please get your response to that?
Thank you for having me. I can attest to all the images that are emerging from Gaza. We don't need to have a medical degree to see that a lot of people are starving. We have seen a lot of bodies of children who are looking like skeletons already. And we have heard reports which are more credible than the Israeli Prime Minister from the United Nations General Secretary and also from the World Health Organization Director. We see a lot of images coming through showing people suffering from starvation. We recognize all these signs, and this has been going on. And now we're witnessing deaths which have been reported to have exceeded 100 deaths from the starvation, and that doesn't happen just by skipping one meal. So this has been systematic starvation. It's a man-made catastrophe, and we need to take steps. We need our government and we need all the international community to step in and act before we see huge numbers of people dying and suffering with very painful death.
Yes, and the world has been seeing these images, and we are seeing them right now as we speak, Doctor. We see babies clearly suffering, dying from severe malnutrition. When a child, can you tell us as a physician, when a child gets to that stage, what is the body going through and what are the chances of survival at that point?
Well, because it's been prolonged, and children are among the vulnerable group of people where their reserves are not high. So their bodies start shutting down. With their metabolism stop working properly, then they will have a lot of effects on their brain function, brain growth, their muscle mass, and all these things. And their growth will be stunted at this stage, as well as their immune system will not be able to fight off the usual germs that they might experience. And that will lead to a death, which is really a painful death. And it's sad that we're seeing something like this happening in the current day and age and stream live to all of us all over the world.
Yes. And, for those who do survive, what are the medium to longer term health consequences?
There will be major health consequences about their brain development, their growth, and there will be major psychological effects for this. This is for those who are lucky enough to survive, they will have a long-lasting effects to the rest of their lives. Well, that's why we need to step in now to try and avert some of this, but we won't be able to reverse it all completely.
Yes, I was going to ask you, even if an appropriate amount of aid was brought in, will that necessarily mean that, this will resolve the malnutrition, at least at a very large scale?
It won't guarantee that everything will be improved, but definitely it will have a massive effect, and it might reduce the number of deaths that we will be seeing. So that's why we need to act, and our Prime Minister Anthony Albanese and Foreign Minister Penny Wong have spoken, and Prime Minister said that this is indefensible, and we need now this to follow with actions. We need pressure to let the aid come in unlimited, unhindered, and the aid to reach everyone who needs it. And we also need medical aid. As part of PANZMA, we have been sending medical missions, and our doctors and nurses on the ground have told us a lot about what's going on. And some of our staff are now going through hunger and not having meals, sometimes for over a day or two even.
Yes, can I get you to elaborate on that? What have your PANZMA colleagues been telling you about the situation and what they've been going through in Gaza?
So we've all been witnessing things, but what they have described to us in some of their words is actually beyond just mass starvation. It's a complete annihilation of life by not allowing people to receive any food, any treatment. We're one of the very few or the only Australian health care charity that has presence on the ground. We have completed 16 missions which go there on monthly basis, and we always listen to the feedback and the witness accounts from our doctors and nurses. The whole healthcare system is collapsed completely, and we're trying to help with whatever we can. And that's why we need our government to uphold the values and the Australian values, and also to try and protect the international humanitarian law and try to put pressure on Israel to respect those things and make sure that civilians have access to food, clean water, and health care. It will take a long system to rebuild that health system, long time to do that, but we need to act and act swiftly. We do not have a lot of time. Otherwise, we will face something that will stain our humanity for the rest of our lives.
Yes, and can I ask you as well, from what you have observed, you are Palestinian, you grew up in the West Bank, but as far as these shortages of aid are concerned, how much of a problem or has been Hamas? Because there have been accusations that they have been stealing the aid and perhaps not facilitating where the food is supposed to get to.
Well, I'm no expert on that, but we haven't really seen any international independent agencies showing any evidence of that happening at any systematic level. And if Israel is sure of that, why don't they let all the international news agencies, then they can report from the ground. I grew up in the West Bank, and the situation that was more than 30 years ago was very difficult then. I was shot as a child, a 12-year-old, but at least there was a hospital that I was taken to. My parents were by my bedside, and there was food for me and medicine to heal. However, I feel so sorry when I see these little ones, some of them are wounded with no surviving family. And as Dr. Ghassan Abu Sette said, there's nothing more lonely in the world than a bedside of a wounded child with no surviving family next to him. And if you're injured, you have no food to heal, you have no medicine, and you have no hospital to treat you. This is beyond imagination.
Yes, Doctor, when was the last time you were able to get to Gaza?
I have never been able to get to Gaza. I've only been able to get to the West Bank because normally people from the West Bank can't go to Gaza. I would love to go to try and help and provide my services there. And I really think that we all here in Australia, the Australian community and the Australian government should do a lot more to help us to get this medical aid and to get those medical missions that make a huge difference on the ground and support us in PANZMA.
Yes. And can you tell us, when in your last trip to the West Bank, what was the situation like there for you?
The situation has changed a lot. That was a few years ago. And again, the settlements have taken a huge part of the West Bank. Getting from one place to another place can be a very challenging reality because people think that the West Bank is a much better place, but actually there is a lot of suffering, a lot of difficult situation. The medical healthcare system there is also suffering because of the economical pressure and because of the blockades and the difficulty of transporting people sometimes between one city and the other if they require specific specialist treatment.
And finally, Dr. Muntaser, can I get your thoughts about what you felt when the French president announced that he plans to recognize a Palestinian state later this year? I think it's September.
Yeah, I think this is a very important step, but it has been very late. I think all the world leaders should recognize the peace process started over 30 years ago, and it was meant to lead to a Palestinian state within 5 years. We need the international community and the French president. We've heard things from the British Prime Minister and from the German and from our leadership here in Australia. We need to all put that pressure to try and bring the Palestinian state, because Palestinians has the right for self-determination and has the right, like any other people, to live in a free, safe, and have the right to access to food, to health, and to education, like everyone else.
Okay, Dr. Muntas Musame, we really appreciate your time this evening. Thank you so much.
Thank you for having me. Thank you.